Hi, I'm Dr. Anil Shah, and I'm going to be talking about a different case every week. And today's case is a patient who is of South Asian origin who wanted to change her nose. If you're not interested in all of the details, skip to the final analysis that has a quick summary point of what we're talking about. The goal with these videos is for you to understand what different patients want, what the process is like, all the details about rhinoplasty, so that if you've had a rhinoplasty or considering rhinoplasty, you can understand and make better decisions about it. So this is a lot of details. Okay, we're going to first jump in. Here's our lovely patient. She's in her 20s and South Asian origin. We're going to look at her nose on the side, and we can see that she actually has a gorgeous nose, I think, but it's not the nose that she wants. It's a little bit of out of proportion with the projection of the nose with her lips and her chin. And this is called Richter's line. So ideally, you want that line to be a little bit more in proportion. She also feels that when she smiles, let's see if we can see that here. She's not quite smiling in here, but when you see her, the nose drops a little bit. Especially on this three-quarter view, you can see how the nose feels like it's a little bit more out of proportion than the rest of the facial features. Again, I like this nose on her, but it's not the nose that she wants. As we're looking at the nose, when we pause on the front view, we can see that the nose is deviated. And so she does have some deviation going on through here. Usually you can see this deviation exacerbated with smiling. And you can see how the nose is deviated. It's going off to her left. The tip actually doesn't look bad in the front, but there's a difference between her left and her right nostril. She's wider through here. And then we really want the eyes to kind of really stand out a little bit. So we'll talk about potentially narrowing this. I think her tip definition actually doesn't look bad, but we're going to be improving that. And you can see how the tip is going off here to the right on her. On her other three-quarter view, she has two different three-quarters views. And that's pretty common in patients who have asymmetry with the nose. They'll have two different profiles and two different three-quarter views. And on the side profile, again, not a bad side profile at all. But again, this is not the nose that the patient wants. She wants this all to kind of line up with her nose. So our goals are basically she wants her nose brought back or deprojected. She wants her bridge to be mellowed. She actually wants to look quite feminine. So she wants a little bit of a curve to her nose. And she wants to see she's had a drastic difference in the nose. Everyone comes in with different demands. You can see we're going in different depths. We can look at that. We can see this deviation. This is an interesting view. Again, you can see how the nose is off to the right better in this view. And we know that there's going to be a deviated septum. This patient's not only wanting to change the outside appearance of her nose, she wants her breathing to be better as well. And it's a pretty common request. When you see these little deviations along the way, that means that the structure of the nose needs to be straightened. Again, you can see the width of the nose on this view. And then pausing, we can again see where the nose is at. Again, in relation where the nose feels like it's slightly more projected. And these are challenging noses because a lot of patients of South Asian origin, they have thicker skin like this patient does. They want the nose smaller. They want it lifted. They want the nose volumetrically smaller. And again, with dealing with thick skin, we have to manage her thick skin. And can we make her nose smaller? That's a challenge for lots of different surgeons. Okay, so that's our initial analysis. Okay, so this is the same patient on the OR table. You can see how the nose looks different on the OR. And I have lots of patients who look at the nose and say, hey, I really like how this person's nose changed. You could kind of have an idea of what the nose is going to look like, but not 100%. If I over-project her nose, which is what the patient doesn't want, her nose will look awesome on the table. But she wants her nose closer and smaller. And so kind of our goals over here is we're going to want to balance out her bridge, deproject her nose based on what we saw pre-op, straighten her nose, and then balance this out. So not only do I have to deproject her nose, I'm going to have to strengthen it so it doesn't move when she's smiling. Again, you can see on her other side, tip slightly here to the right, nose wider than ideal, thicker skin. And again, if we're looking at her on the OR table, we might think that her tip is under-projected, but based on what we saw with her standing up and saw her in real life, we want to deproject her, balance out the tip, make the tip smaller and straighter, so it's a three-dimensional change. And we're going to want to narrow her as well from the top. Okay, so we have her on the OR table. And I'm going to pause here. So she's slightly deprojected, which is, again, it's a little harder to see. Sometimes you don't get the perspective of how things look in the OR. We can see her bridge is balanced. And again, they're swollen in the OR, so you don't see everything that you want to see on here. So when we look at her 3/4 view, we'll see that the nose, the tip, at least in the OR, looks straighter. Her nostrils look more symmetrical. And that there's going to be some swelling. We're dealing with a South Asian skin. You can see I've definitely removed skin along the sides. Other things I did with the nose is I narrowed the bridge. I used an ultrasonic approach to soften the bridge and also narrow the sides of the nose. And then I supported the tip as well as made it stronger, even though I deprojected it. Here we can see the other side, and we can see that the nose, again, improved shape. Tip looks like it's in better position. And again, all indications, we've done all the things we wanted to, which is deproject the nose, lift the nose, create a curve to the nose, and change that shape. Also straighten out the nose. So here we are at 1 week. We can see that it roughly approximates the shape that we made in the OR. It's kind of important when you look at a 1 week result that not all of the patients are going to see everything. It's going to be based on their skin thickness. We can see her projection is better. She's a little short right now, and a lot of that's from the swelling, the nose having to settle down a little bit. But we can already see some promise with her profile. And as you watch the nose flip around through here, we can see some bruising. The tip looks like it's in better position. And again, our profile, I already like that outline and that shape we're seeing for her profile. It's closer to the image that we talked about. We've lifted the nose, worked with that component of it. We worked with her projection. And this outline of the lip, chin, and tip seems like it's more in alignment. And even though she's swollen, it does seem like her eyes are really standing out a little bit more. We're 3 months out, and we can see that the nose, it's starting to settle a little bit more. There is some swelling along the nose, pretty common to see that. Again, I like the general shape. Not seen as much definition from the front. Again, I like the general shape through here. There's still a little fullness in the super tip. These visits are super important for patients because with the visits here, she's going to get her scars lasered. I'm also going to inject sometimes Canalog or something to decrease tip swelling. She's also taping her tip just to kind of improve the way everything looks throughout there. And again, the goal over here is really just to kind of minimize the amount of edema we see throughout here and kind of improve that. So again, if we're looking at this, not bad for 3 months, but again, just generalized edema through here. Again, looks good. And she's looking pretty good in photos at this point. Let's just see what happens when we fast forward to 9 months. And here we are 9 months after surgery. So let's take a look at this. Here's the tip, here's the lip, here's the chin. The nose hasn't really lost projection, hasn't gained projection. That wouldn't make sense for it to do that. I'll give a little just different camera perspective. I like the shape of the nose overall. She's got that gentle curve, which I think is very feminine, balancing out with her bridge. To me, still looks very natural and South Asian. We'll look through here. From the front view, we're starting to see that better line and better shadow through here, which is pretty common at 9 months. Her tip, again, tip definition looks really good for her. I like the symmetry from the front as well for her. And there's that profile. Again, just balancing out that profile, improving all of that together. So if we're looking at this, what are some of the takes on this? I think, first of all, what do we actually do for her? So this is kind of a summary of everything. We straightened out her septum. When most people try to straighten out a septum, they'll straighten out a portion of it. For her, in her case, you can see that the tip was off. The middle part of her nose was off. So I straightened out the entire septum. Again, I have strong opinions here, but I think if you don't straighten out the entire septum and try to kind of hide that with grafts, you tend not to create as straight of effect as you want. Other important effects here. We balanced out her bridge with ultrasonic reshaping, narrowed her bridge with ultrasonic reshaping. And that's important to know, not just for the narrowness, but also help reshape her nasal bones. For the tip of the nose, we deprojected it and supported it. And there's a variety of techniques you can use, but in this case, again, it's really hard to do that in South Asian thick skin, even though that's hard to do with thicker skin. We were able to do that and improve that. And then just to remove some of the skin, we made an external incision. We used 3 scars on her, 1 on the bottom and 2 on the sides. And by removing some of that extra skin along the nose, you're able to redrape it. So overall, this patient's nose is straighter. She's breathing better. and her nose meets the goals that we talked about.